Welcome to annual enrollment for the 2024-2025 benefit plan year. Annual enrollment is your opportunity to make changes to your benefits without a qualifying life event. During this time, you can add new coverage, drop existing coverage, or make changes to your current plans, such as adding dependents or switching between plan tiers. The choices made during this period usually remain in effect for the entire plan year, unless you experience a qualifying life event that allows for mid-year changes. It is important to review your benefit options during annual enrollment and make informed decisions about your benefits. Make sure you save a copy of your enrollment confirmation and review your elections once you have completed your annual enrollment. Eligible dependents include your legal spouse or domestic partner, your child or stepchild, your legally adopted or foster child, a child required to be covered under a qualified medical child support order, or a child who resides with you as their legal guardian. A child is considered an eligible dependent until the end of the calendar year of their 26th birthday. If your child turns 26 in June, they will be eligible for coverage until December 31st. Adult disabled children may remain covered under your insurance after they turn 26 if specific criteria are met. Additional information about adult disabled children will be presented on the next slide. Adult disabled dependent updates. During annual enrollment, members with adult disabled dependents will be required to provide a disabled dependent affidavit for any dependent children who are over age 26 and covered under medical, dental, or vision with IQBA. The affidavit requires you to submit demographic information for you and your disabled dependent, as well as information from your dependent's primary care provider about their disability. Coordinate with your HR or benefits team about what to do with the affidavit once it's complete. Adult disabled children may remain covered under a parent's medical insurance plan, provided the following criteria are met. The dependent must be a child of the plan member. A child includes a plan member's natural child, legally adopted child, stepchild, foster child, and any child with proof of legal guardianship by the plan member. The dependent must be 26 or older and be mainly dependent on the plan member for support. The dependent must also be unable to provide self-support due to a mental or physical disability, and be claimed as the plan member's dependent for income tax purposes. If not claimed as a dependent for income tax purposes, they must be eligible for Social Security income or Supplemental Security income, SSI, as a disabled person. Or they must be working in supported employment which may offset Social Security or SSI. Next up, important changes to your benefits effective April 1st, 2024. Effective April 1st, 2024, IQBA members enrolled in medical insurance will have a $500 emergency room copay. The ER copay is waived if you're admitted to the hospital. Looking for alternatives to the emergency room? Scan the QR code on screen to search for urgent care centers using the Embold Health Provider search tool. Effective April 1st, 2024, IQBA members enrolled in medical insurance will have new deductible and out-of-pocket limits. The individual in-network deductible is increasing by $500. The family in-network deductible is increasing by $1,000. The individual in-network out-of-pocket maximum is increasing by $1,000. The family in-network out-of-pocket maximum is increasing by $2,000. Please refer to your benefits guide for additional information about your deductible and out-of-pocket maximums. Prescription savings with IQBA Cares and RxSS. New from your IQBA Cares Pharmacist Advocate team. IQBA Cares has partnered with Rx Savings Solutions to provide you with easy access to prescription pharmacy savings. Savings opportunities are personalized for you, based on medications you are currently taking. Once you activate your MyRxSS account, you can view available savings and make the switch at the click of a button. Scan the QR code to register and activate your account today. You can also visit myrxss.com to get started or call the iCuba Cares team with questions at 877-286-3967, Monday through Friday from 9 a.m. to 5 p.m. iCuba is happy to announce there are no premium increases for dental, vision, voluntary products from Aflac, legal and identity theft services from Legal Shield, or voluntary life and disability from Symetra. The premium for these benefits will remain the same for the new plan year. iCuba's new weight management guide. iCuba and Blue Cross Blue Shield have collaborated to create our whole-person approach to weight management, an online guide with easy access to all the resources you and your covered dependents will need on your weight management journey. Scan the QR code on screen to access the guide and save a PDF copy. New from Aetna, Brightline Virtual Mental Health Care for kids, teens, and families. Whether it's virtual therapy, psychiatry, or coaching, Brightline will work with you to find the right support for your kids and teens. Chat with an expert within minutes and schedule a video visit within days. Brightline is included with your behavioral health coverage from Aetna, subject to the copays associated with mental health care office visits. Scan the QR code on screen to get started with Brightline today. New Healthcare Flexible Spending Account, or HCFSA elections are required each year. An HCFSA is a pre-tax benefit account that can be used to pay for eligible medical, dental, and vision care expenses that aren't covered by your insurance plan. You contribute to an HCFSA through salary deductions set at the beginning of the plan year. For iCuba, the plan year begins on April 1st. These contributions are not subject to payroll taxes, which can result in significant tax savings. Funds in an HCFSA can be used for a wide range of out-of-pocket healthcare expenses, including deductibles, copayments, prescription medications, and certain over-the-counter items. It is important to plan carefully, as HCFSA funds are subject to the use it or lose it rule, meaning any unused funds at the end of the plan year, plus the grace period, will be forfeited. New Dependent Care Flexible Spending Accounts, or DCFSA elections are required each year. A DCFSA is a pre-tax benefit account used to pay for eligible dependent care services, such as childcare, preschool, summer camps, and before or after school programs. It can also be used for adult daycare for elderly dependents who are incapable of self-care. Employees contribute to a DCFSA through salary deductions, which are set at the beginning of the plan year and are exempt from payroll taxes, leading to potential tax savings. It's important to note that, unlike an HCFSA, the funds in a DCFSA must be used for expenses incurred for the care of a qualifying dependent while the employee is working or looking for work. As with an HCFSA, careful planning is necessary because funds are subject to the use it or lose it rule, meaning any unused funds at the end of the plan year, plus the grace period, will be forfeited. Medical Insurance Premium. Please review your medical insurance premium for the new plan year. Please refer to your benefits guide for additional information about your benefit premium. Next up, enrolling in your benefits. Things to consider during annual enrollment. Click the Easy button on your annual enrollment. Check your email for your annual enrollment reminder and click on the button labeled Let's Get Started to review your elections for the new plan year. Accessing a single sign-on to the iCuba Benefits portal in Workday is easy. Log into Workday and click on the External Resource Links button. Next, click on the link labeled iCuba Benefits portal. Now you have single sign-on access to all your benefits in one easy-to-access location. Some providers may require you to register for access before the single sign-on feature is active. Single sign-on connections are available for all your iCuba benefit elections in the iCuba Benefits portal. To establish a secure connection, click on the link for each provider under the My Carrier Accounts section and confirm your information. Some providers require you to complete a brief registration and establish a username and password for access outside the benefits portal. Get ready for the first stop on your annual enrollment journey. Comprehensive medical insurance and prescription coverage from Blue Cross Blue Shield of Florida. With iCuba, your medical insurance means more. Every medical insurance election includes plan enhancements from Embold Health, Surgery Plus, Strive powered by Virgin Pulse, Hinge Health, Virta Health, My Health Novel, and Able to. When you elect medical and prescription coverage from BCBS, you have behavioral health benefits bundled from Aetna, but administered separately. This means you need to present your BCBS ID card for medical and pharmacy visits and your Aetna ID card for behavioral health services. No cost. No deductible. No barriers to care. iCuba's benefits are designed to identify and treat chronic conditions before they become a problem, helping to remove barriers to your healthcare. That's why we have no-cost programs like $0 copays for Total Care and Embold Health designated providers, and no-cost services like diagnostic or preventive mammograms, and adult and child immunizations. Remember, you only pay your deductible when you receive major services, and many benefits and services are covered at 100%. The preferred PPO plan includes prescription pharmacy benefits from Blue Cross Blue Shield and behavioral health benefits from Aetna. Care Connected is in your corner for claims questions, benefits questions, help scheduling appointments, lifestyle and weight management programs, and much more. The preferred PPO plan has an individual deductible of $3,000 and a family deductible of $6,000. The individual out-of-pocket maximum is $5,000, and the family out-of-pocket maximum is $10,000. The emergency room copay is $500 and is waived if you are admitted to the hospital. The in-network coinsurance for the preferred PPO plan is 20%. Please refer to your benefits guide for out-of-network deductibles, out-of-pocket maximums, and coinsurance amounts. The high-deductible PPO plan includes prescription pharmacy benefits from Blue Cross Blue Shield and behavioral health benefits from Aetna. Care Connected is in your corner for claims questions, benefits questions, help scheduling appointments, lifestyle and weight management programs, and much more. The high-deductible PPO plan is designed to provide lower monthly premiums to members covering children and families. The plan has an individual deductible of $4,500 and a family deductible of $9,000. The individual out-of-pocket maximum is $6,350, and the family out-of-pocket maximum is $12,700. The emergency room copay is $500 and is waived if you are admitted to the hospital. The in-network coinsurance for the high-deductible PPO plan is 30%. Please refer to your benefits guide for out-of-network deductibles, out-of-pocket maximums, and coinsurance amounts. In-network prescription copays are applied toward your out-of-pocket maximum. Once you reach your maximum, prescriptions are covered at 100% by the plan for the remainder of the plan year. Preferred generic prescriptions have a $5 copay for a 30-day supply. Non-preferred generic prescriptions have a $10 copay for a 30-day supply. Preferred brand prescriptions have a $40 copay for a 30-day supply. And non-preferred brand prescriptions have a $75 copay for a 30-day supply. The specialty pharmacy copay is $75. Greater savings are available when filling your prescriptions for a 90-day supply, except specialty pharmacy. Specialty pharmacy drugs are only available for a maximum 30-day supply. If you have a question about your pharmacy benefits, call Blue Cross Blue Shield at 855-811-2213 or call an iCuba Cares pharmacist advocate at 877-286-3967. Free diabetic supplies from Blue Cross Blue Shield. With a prescription from your provider, you can receive free diabetic supplies including meters, lancets, test strips, control solutions, needles, and syringes. Other free items include prescribed aspirin for adults, prescribed generic folic acid, and generic prenatal vitamins for pregnancy. Simply take the prescription to the pharmacy counter and your local pharmacist can assist you. Real pharmacists. Real advocates. Real solutions. The dedicated team at iCuba Cares supports members like you who need help understanding their pharmacy benefits. iCuba Cares is an advocate who will work directly with you, your healthcare providers, pharmacies, and insurance companies to address your medication-related concerns to you and your family members get the best possible outcomes. iCuba Cares has also partnered with RX Savings Solutions to provide you with savings opportunities personalized based on the medications you are currently taking. Once you activate your MyRxSS account, you can view available savings and make the switch at the click of a button. Scan the QR code to register and activate your account today. You can also visit myrxss.com to get started or call the iCuba Cares team with questions at 877-286-3967, Monday through Friday from 9 a.m. to 5 p.m. Coming up, behavioral health benefits from Aetna, resources for living. Behavioral health benefits are attached to your medical insurance coverage from Blue Cross Blue Shield of Florida. Your mental health matters. Aetna Behavioral Health and Resources for Living are here for you. You can access up to 6 counseling sessions per issue each year. iCuba's EAP is available 24 hours a day for in-the-moment emotional well-being support. Counseling sessions are available face-to-face, via televideo or chat therapy. Services are free and confidential for every employee at an iCuba member school and every member of their household, even if they are not covered under an iCuba medical insurance plan. Brightline's child and adolescent therapists and psychiatrists are licensed mental health experts with master's and medical degrees, respectively. Behavioral health coaches hold a master's degree in a psychology-related field or a bachelor's degree with a certification in coaching and have 5+ years of experience working with kids, teens, and families. All therapists practice evidence-based cognitive behavioral therapy, CBT, and our coaching programs are CBT guided. Brightline is an in-network provider with Aetna. Standard out-of-pocket costs and deductibles apply. Brightline Incorporated does not itself provide any physician, clinical, behavioral health professional, or other healthcare provider services. Scan the QR code to get started with Brightline. Behavioral health coverage is bundled with your medical coverage but administered separately by Aetna, Resources for Living. The copays and coinsurance amounts are the same as your medical coverage and vary depending on the medical plan you are enrolled in. Deductibles and out-of-pocket maximums are combined with your BCBS medical insurance. Since your behavioral health coverage is administered by Aetna, you'll need to use your Aetna member ID card and search for behavioral health providers in the Aetna portal when verifying coverage. Behavioral health providers in the Blue Cross Blue Shield or Embold provider directories may not be in-network with Aetna. Using your medical insurance member ID card when seeking behavioral health and substance abuse treatment will result in a denial of your claim and could result in higher out-of-pocket costs if your provider is not in the Aetna network. If you have questions about your behavioral health benefits, call Aetna, Resources for Living at 877-398-5816 and select option 2 after the prompt. Get ready for the next stop on your annual enrollment adventure. Exclusive benefits for iCuba members enrolled in a medical insurance plan. With Embold Health, you have access to the highest quality providers already in your Blue Cross Blue Shield network. Embold Health uses advanced analytics and feedback to healthcare providers to continuously monitor their health outcomes and make sure you get the right care, from the right provider, at the right time, and at the right cost. If you visit an Embold Health designated provider, your visit will be covered 100%. That means no co-insurance for your visit and more money in your pocket. Provider eligibility may vary from year to year, so be sure to check your provider's Embold Health designation by visiting www.icubabenefits.info and clicking on the Embold Health tab in the navigation pane. Use Teladoc when you need care on the go, have a non-emergency issue, or if you need short-term prescription refills. Teladoc is a convenient and affordable option for care to treat minor medical conditions including, but not limited to, cold and flu, bronchitis, UTIs, sinus problems, and many more. And the best part? Teladoc is available for a low, $5 copay. All Teladoc physicians are board-certified practitioners in pediatric or family medicine with at least 15 years of experience. Remember, Teladoc is a great way to get convenient care on the go but should not be used as a replacement for your primary care provider. Use Surgery Plus and save. Surgery Plus provides iCuba members with access to high-performing surgeons of excellence for covered surgical procedures. Surgery Plus providers are not regular network providers. You may need to travel away from home for your procedure. But don't worry if you do travel. Surgery Plus pays travel expenses and hotel accommodations for you and a companion. The best part? When you schedule an eligible procedure through Surgery Plus, you skip the co-insurance, deductible, and out-of-pocket maximum cost. Full concierge service is available with a dedicated care advocate to assist you along your healthcare journey. Get started today. Call 855-200-2119 to speak with a care advocate. Virta goes beyond other diabetes and weight loss treatment programs. This comprehensive program doesn't just treat your symptoms. With Virta, you learn how to change your eating habits so your body burns fat for energy instead of sugar and carbohydrates. Doing this naturally lowers your blood sugar and reduces the need for diabetes medication. It can also help you lose weight and live a healthier life. iCuba fully covers the cost of Virta, valued at over $3,000, for you and your eligible family members with type 2 diabetes. Scan the QR code to get started today. Ready to lose weight, feel energized, or just live healthier than ever? Join iCuba's free well-being program, Strive, powered by Virgin Pulse. Strive provides a fully customizable health and wellness platform to everyone enrolled in medical insurance through iCuba. Eligible members enrolled in an iCuba medical plan can earn up to $250 for completing health and well-being milestones and getting their annual biometric screening. To enroll in Strive and start earning incentives, challenge your coworkers, and track progress on your journey to a healthier you, visit myhealthtoolkitfl.com or scan the QR code to get started. My Health Novel is designed to match you with helpful tools and resources based on your specific health needs. My Health Novel programs are available to all members who are enrolled in the BCBS Medical Plan for weight management, diabetes prevention, intensive behavioral counseling, and many more. My Health Novel gives you access to the best nutrition, physical activity, and weight management tools, programs, and apps available. Log in to myhealthtoolkitfl.com and click on the My Health Novel tile at the bottom of your landing page to take a 1-minute assessment and find out what programs are available to you. You and your family members have access to all the tools you need to manage your pain with Hinge Health. Members like you have reported an average pain reduction of 60% when using Hinge Health. And it only takes 45 minutes per week. Once enrolled, you will receive the Hinge Health Welcome Kit, which includes an Android tablet and wearable motion sensors that guide you through exercise therapy. You'll also be paired with a personal health coach who will tailor sessions to you and your schedule, making sure that your therapy is at the right pace for your needs. The best part? This program is available to you and your eligible family members at no additional cost when enrolled in a medical insurance plan with iCuba. Scan the QR code to register with Hinge Health and get started today. With Able To, you'll get virtual, personalized support to help you cope with grief, depression, anxiety, caregiver stress, and more. This 8-week program is available through Aetna, Resources for Living, and will help you better manage stress and improve your overall health. Able To can help you manage health conditions and life changes, manage stress and improve your mood, feel like you're in control of your health and your life, engage in things you love to do, and set boundaries to better manage your time. It's really easy to take the first step, and you can usually speak with a licensed therapist within 7 days of calling. If you're ready for a little extra help from Able To, give Aetna a call at 877-398-5816 and select option 2 after the prompt. Coming up next, comprehensive dental benefits. With the Delta Dental Base PPO plan, you can visit any licensed dentist to receive treatment under your plan, but you'll maximize your savings by visiting a dentist in one of Delta's nationwide networks. On the base PPO plan, braces are only covered for children up to 18 years of age, with a maximum lifetime orthodontia benefit of $1,500. The base plan has a $1,500 plan year maximum, individual and family deductibles, and co-insurance for basic and major services determined by which network your provider is in. Your dental co-insurance applies for each member after the individual deductible has been met. The Delta Dental mobile app is optimized for iOS and Android devices. Scan the QR code on screen to download the mobile app today. With the Delta Dental Buy-Up PPO plan, you can visit any licensed dentist to receive treatment under your plan, but you'll maximize your savings by visiting a dentist in one of Delta's nationwide networks. On the Buy-Up PPO plan, braces are covered for adults and children, with a maximum lifetime orthodontia benefit of $2,000. The Buy-Up plan has a $2,000 plan year maximum, individual and family deductibles, and co-insurance for basic and major services determined by which network your provider is in. Your dental co-insurance applies for each member after the individual deductible has been met. The Delta Dental mobile app is optimized for iOS and Android devices. Scan the QR code on screen to download the mobile app today. The Dental HMO plan provides the most flexible and affordable dental benefits with fixed copays for services, and no annual maximum or deductible. It is important to note that the Dental HMO plan is not available in all 50 states, so please check your eligibility for coverage if you, or one of your dependents, are outside the state of Florida. You'll need a referral from your DeltaCare USA primary care dentist before getting braces. Your primary care dentist will submit the treatment plan to Delta for approval prior to starting your treatment. If you start treatment prior to receiving approval, your claim could be denied, resulting in higher out-of-pocket costs for your treatment. The Delta Dental mobile app is optimized for iOS and Android devices. Scan the QR code on screen to download the mobile app today. Coming up, comprehensive vision benefits. With the iMed Base PPO plan, you'll have coverage for prescription glasses and contact lenses with a $130 frame allowance every 24 months, a $15 lens copay, plus fixed pricing on options every 12 months, and a $100 contact lens allowance, with coverage for fit and follow-up every 12 months. Contact lenses are instead of glasses. That means you are entitled to a full pair of glasses, including frame and lenses, or contacts and frames, you would then receive a 20% discount on your lenses. The frequency of benefits is based on the date of service. If you receive an eye exam today, you are eligible for another eye exam 12 months from today's date of service. Keep in mind that vision insurance is for glasses and contact lenses only, not for the medical treatment of conditions like glaucoma or cataracts. Medical treatment of your eyes is covered under medical insurance from Blue Cross Blue Shield. With the iMed by UP PPO plan, you'll have coverage for prescription glasses and contact lenses with a $160 frame allowance every 12 months, a $15 lens copay, plus fixed pricing on options every 12 months, and a $130 contact lens allowance, with coverage for fit and follow-up every 12 months. Contact lenses are instead of glasses. That means you are entitled to a full pair of glasses, including frame and lenses, or contacts and frames. You would then receive a 20% discount on your lenses. The frequency of benefits is based on the date of service. If you receive an eye exam today, you are eligible for another eye exam 12 months from today's date of service. Keep in mind that vision insurance is for glasses and contact lenses only, not for the medical treatment of conditions like glaucoma or cataracts. Medical treatment of your eyes is covered under medical insurance from Blue Cross Blue Shield. The next stop on your annual enrollment adventure awaits. Up next, group life and disability benefits. While you typically do not have to elect life and disability benefits during annual enrollment, it's a great time to review and update your beneficiary information. Basic life and accidental death and dismemberment insurance is provided by your employer at no cost to you. If available, spouse and child life insurance are voluntary benefits that you can enroll in to provide an extra layer of protection for you and your family. Age restrictions and enrollment limitations may apply to some voluntary life insurance benefits. If available, short and long-term disability products are benefits that you can enroll in to provide income protection in the event you are unable to work for an extended period. Some benefits may not be available from your employer. Please check your benefits guide for a summary of the benefits you are eligible for. During annual enrollment, you may have an opportunity to increase your life and disability coverage. Doing so will require you to provide evidence of insurability, or EOI, to the insurance carrier. EOI requirements vary from employer to employer. If you make changes to your life or disability benefits, you may want to verify with your Human Resources or Benefits Department if EOI is required. EOI is generally required when you elect coverage in excess of the guaranteed issue amount for your benefit, or if you are electing a benefit outside of your initial eligibility window, typically your new higher enrollment window. Scenarios when EOI is required include, but are not limited to, the following examples. You add disability benefits to existing coverage, you apply for group life coverage that exceeds the guaranteed issue amount, you increase a current group life insurance election, or you enroll in group life insurance coverage after the initial eligibility period. If you make changes to your life or disability benefits, it is a good idea to check with your Human Resources or Benefits Department to see if EOI is required and what steps you may need to take to complete the process. Coming up, legal services and identity theft protection services. Legal Shield provides legal services at a fraction of the cost of hiring a private attorney, making legal assistance more accessible and affordable for you and your family. With Legal Shield, you have direct access to a dedicated law firm that can review and prepare legal documents like trusts and wills. The Legal Shield team can also help with other personal legal matters such as speeding tickets, HOA disputes, and adoption. With Legal Shield, you pay a fixed monthly fee, eliminating the worry of costly hourly legal rates for common legal problems and questions. If you have ever worried about becoming a victim of identity theft, lost your wallet, used public Wi-Fi, or have been mistakenly pursued by a collection agency, you may benefit from ID Shield. When you combine the benefits of Legal Shield coverage with the protection of ID Shield, you have access to all the tools and resources you'll need to protect yourself and your family. For more information, scan the QR code on screen. Next up, personal insurance protection from Aflac. Chances are, you may know someone who's been diagnosed with a critical illness. You can't help noticing the difference in the person's life, both physically and emotionally. What's not so obvious is the impact a critical illness may have on someone's finances. Critical illness coverage can help with the treatment costs of covered critical illnesses, such as a heart attack or stroke. More importantly, the plan helps you focus on recuperation instead of the distraction of out-of-pocket costs. With the critical illness plan, you receive cash benefits directly, unless otherwise assigned, giving you the flexibility to help pay medical bills or everyday living expenses. Every employee is eligible to enroll in the critical illness plan, regardless of health. All covered illnesses in the policy will be covered if the diagnosis is after their policy effective date. It is important to note that critical illness elections can only be added or changed during annual enrollment. Any stay in the hospital can be expensive, planned or not. Hospital indemnity coverage is available to help when you are hospitalized and may be required to meet your deductible and have out-of-pocket obligations under your medical plan. Lump sum benefits are paid directly to you based on the type of facility and number of days of confinement. Hospital indemnity plan benefits include coverage for the following: a hospital confinement benefit, including pregnancy, a hospital admission benefit, including pregnancy, a hospital intensive care benefit, and a successor insured benefit. It is important to note that hospital indemnity elections can only be added or changed during annual enrollment. The voluntary accident plan is designed to help cover the expenses associated with an accidental injury. The accident plan pays cash benefits directly to you for emergency treatment, hospitalizations, specific injury treatments, diagnostic exams, and accidental death. Plan features include an emergency room payment of $175, an X-ray payment of $50, a hospital admission payment of $1,000 per confinement within 6 months of the accident, and a wellness benefit of $50 each year. It is important to note that accident protection elections can only be added or changed during annual enrollment. The voluntary pet insurance program is available from Nationwide Insurance, coupled with exclusive rates for ICUBA members, allows you to provide care for your pets without breaking the bank. Like human medical insurance, pet insurance plans from Nationwide have deductibles, co-insurance, exclusions, and pre-existing condition limitations. You can choose coverage that fits your needs, ranging from 50% to 90% reimbursement on vet bills and more, depending on which plan you enroll in. Added features include additional savings with preferred pricing, the ability to use any veterinarian, and cash back on some veterinarian bills. For exotic pets or avian coverage, please call 877-738-7874. Please note, Nationwide pet insurance is not collected through payroll deduction with your employer. After enrolling in coverage, you will make premium payments directly to Nationwide. Scan the QR code on screen to learn more. Thank you for viewing the annual enrollment presentation. Please scan the QR code on screen and let us know how we are doing.